This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner. I'm joined today, as always, by the glistening Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon.
Is it good to be glistening?
Yes.
I'm not sure.
It's glistening, like brilliant and bright.
I feel like glistening people are usually sweating too much, and I feel like that they're about to have a heart attack.
That's different.
Okay.
I mean, it is January, so if you do hear like a big gush of like wind come on, it's just because it's freezing here in Denver and the heat might be kicking on aggressively, which we appreciate, but it is loud. So today we are talking about breast augmentation myths. If you are listening to this episode and you want to watch it, it's not that interesting of an episode to watch because it's just me and Dr. Martin talking, but that's still pretty interesting. You can find us on YouTube at Jason Martin.
I think it has some comical relief when you watch Amy and I making faces at each other. It's good.
Yes.
I have to focus on this episode because I'm still thinking about my Live Your Best Life challenge.
Right, which you're actually they don't know much about it yet, except that we launched it. Well, we talked about it in our last episode on January 1st, but we're going to be giving you all the details in 2 weeks on the February 1st episode. So definitely go back and listen to the end of
I got to really think through this.
Yeah, it's in the timestamp. So go back to the timestamp on our January 1st episode and listen to the reveal of the Best Year Ever challenge. And we'd love to have you join us. So we'll be telling you a lot more about it February 1st. So you have a little bit of leeway. You have a month to live your, previous best life before you get ready for your new best life.
Because behind the scenes, I'm turning 40,
right.
maybe. I'm turning 40.
40. Big milestone.
I hate when people do that. It's like, okay, great. You're turning 40.
You're not 21.
Same joke over and over. Yes. Whenever I do fat transfer, the loved ones who are like, I'm, seeing the patients in the pre-op area, this is like in the OR, and the loved ones always say, can I donate my fat? I'm like, I've never heard.
Right. Like, haha, like, can you take my love handles? Like, never heard it before. Yes. Like,
yeah, you can donate your fat. And actually, Mom, why don't you come back with us to the OR? I'll liposuction you for free and take all that fat and inject it into your daughter.
Yeah.
That sounds a little bit uncomfortable.
Yep, not going to happen. Yeah. So today we are not talking about any of that. We're talking about breast augmentation myths. We did an episode in 2022 talking about facelift myths. And I thought, this is actually something that there should be more of. So for those of you who might be a little bit intimidated by the length of our podcast, perhaps like you see like, Breast Aug 2.0, but it's an hour long. Like, and I just really want to know this. Look in the description box. All of these myths, there's 10 will be timestamped. There are definitely more myths. So we'll probably have a breast augmentation myths 2.0 episode that comes out sometime. So I did have to reduce it to just kind of the 10 most common that I think need to be busted. So look in the description box. If you only want to listen to, myth number 10, jump to myth number 10, like whatever. Yes. While you're here though, like and subscribe.
This is your playground. Yeah. Use it as you want.
Yes.
No rules.
So let's jump right in to breast augmentation myths.
By the way, real quick, the last time we talked about the myth busters, we're not going to talk about that again, but we're going to bust myths. Yes. Okay. So it's the same format.
Correct. So myth number 1, the mythical gummy bear implant.
Yes.
I was going to bring gummy bears for you guys, but I have not been to the store. And as I mentioned, it's been like sub-zero temperatures.
Were you going to throw them at the camera?
No, I was going
to
toss a bag to Nils. I was going to give some to you.
I mean,
all implants. Yes. Right?
I'm not arguing.
Especially gummy bears. I love gummy bears. So yes, all implants that are silicone gel at this point in time in 2023 are all cohesive gel implants. That's all the gummy bear was 20 plus years ago when it kind of was a term.
We've talked about this like 1,000 times over. The silicone molecules, SILCA molecules, are adherent to each other. And if you go back to your organic chemistry...
Right, like everybody. Yeah, good times.
I remember I was talking to my son about this. He's like, Dad, this is the most boring conversation I've ever had with you. So the way that they're bonded together, they change those bonds a little bit and they change the molecular structure a little bit to make it more cohesive. We've used the analogy before of Jell-O. Jell-O that's in the refrigerator is a lot more congealed and you can turn it over and it won't spill. If you have Jell-O that's been exposed to heat, it kind of is runny. And it's the same thing with jelly. So the same idea.
But not temperature dependent with silicone.
Right. Yeah. A cohesive implant is a lot more congealed. You can cut it in half, turn it over, and it won't spill out.
Squeeze it.
Yeah.
Yep. Yeah.
The reason why that's important is that we have implants, especially now, that have better form factor. They're overfilled. They have high cohesive gel inside, and they can keep its form better. They can give you more projection. And some of the newer implants now, we were just, Amy and I have been using this Mentor implant, the Boost implant, that they can also feel not too hard, because that's always been the problem before. An overfilled implant feels a little bit harder. People don't like that either. So it's like chicken or egg kind of thing. Like, how do you go about this? But I think that we're getting to the point now where we're having these really good implants that don't feel too hard, but they are overfilled and they keep their form factor, which is better, I think, in the end.
Yeah, and a lot of that has to do with the shell, which we'll talk more about the shell of implants on another myth. But just know that if you are getting silicone gel implants in the year 2023, you are getting a gummy bear implant. And if you want to make your surgeon happy, don't ask if you're getting a gummy bear implant. Just bring gummy bears.
The joke we made, because the only reason I know this because we watched all those damn episodes for the end of the year thing, which is a great episode itself too, our top 5 moments. We made the joke that if like gummy bears were so good, why would someone not use them? Like a surgeon, right? So we all use the same implants. No matter what the person you had the consult with said, we all use the same type of implants.
Everyone's using cohesive gel implants. If you are getting a silicone gel implant, it's a gummy bear implant. You don't have to ask. It's what it is. And it's not super special. It's just what they all are. Yeah. And bring me gummy bears, please. Respectfully, please.
Myth busted.
Busted. All right. Dr. Martin, myth number 2.
Your implants have an expiration date, aka the 10-year myth. So I'm not really sure where this came from, maybe studies, but the companies all say, you can think that maybe it's going to last 10 years. And honestly, I've never really seen definitive data on that. I'm sure that there is some.
There is. It's just the average.
The average or median or however they did their statistics on that. But in reality, implants, just so you know, if you have them, can last 30 years. They can last 3 years.
But I think that this is really the myth. It's not the implant. The myth is that it's 10 years between when you will have surgery again on your breasts. So that may not be because of the implant. Like you might have surgery again 6 months after your initial surgery, not because the implant has failed.
Yes.
But because something else has gone wrong.
And actually, implant failure is very rare.
Yeah.
So
your implant doesn't expire. And the reason you're having surgery again is, yes, because of your implant, but not necessarily because of a defect or a default of your implant.
A failure of the implant, like it rupturing. And by the way, these cohesive gel implants, which we talked about, are gummy bear. They're very special, Amy. They're gummy bear.
They're gummy bear. They also don't leak for that reason. They rupture. They don't leak.
Yeah. They don't really, in most cases, travel places. They kind of stay where they are. So sometimes it could be hard to evaluate that. And an MRI study is the gold standard. That may be one of our myths.
We're going to talk about myths later.
Yeah. MRI is the gold standard on that. But implant-related problems are usually not related to the implant itself. It's usually related to the scar tissue around the implant, asymmetry, bleeding after surgery,
age,
infection around the implant. Not the, it's of the implant, but it's infection around the implant. The implants are almost always intact. So,
but people come in all the time like, oh, I've had my implants for 10 years. Should I get them changed? Like, are they soft? Do you like them? Don't do anything.
Right. And we're not shaming the patients because that's what they were told. But
exactly. That's why it's a myth. Like people do think that. And like why it is, it just is. But your implants do not have an expiration date. Enough said.
That's right.
You can have them 1 year.
It's not yogurt or milk.
Right. You can have them 1 year, you can have them 40 years. Like your implant itself does not expire.
Which is very funny. I'm saying this because there actually is an expiration date on the box.
On an unimplanted implant. And that's for sterility, though.
It's for sterility
purposes. It's not because the implant is no longer good. It's just that you can only guarantee sterility for X amount of time.
Every now and then you'll get a new circulating nurse and they're like, oh my God, is this thing going to expire soon?
Right. Like, oh, you're putting an implant, it expires next year.
Yeah. It's like, what does the patient do then? And then I'll always say something like really acerbic, like, I'm not really sure what we're going to do.
Yeah,
we'll figure it out.
Gosh, right? They fall out.
Like, oh my God, this guy's such an asshole.
But no, your implant does not expire. So the 10-year myth is just that it's a myth. Yep.
Busted.
All right. Myth number 3. You will never need breast surgery again.
Listen, in our office, Jason Martin, MD, we do one surgery and that's all you need.
Ever. It doesn't matter what surgery it is. But I think breast augmentation, more than any other surgery that we do, has the highest likelihood for having multiple surgeries throughout your lifetime. If you get your breast augmentation when you're 22 years old And on average, women may get some other breast surgery again in 10 years. I mean, you think about that, like you could have 7 surgeries in your life because of your breast implants if you keep them. You're going to get pregnant, you're going to gain weight, you're going to want to change the size. Like there are things that are going to come up. You might have a rupture, like you might have an accident. Things might happen. You might
we didn't talk about trauma.
Yeah.
Motor vehicle collision.
Exactly. Like something might happen. But know this. I don't care if you are 22 or 72. If you are healthy and you're having something done on your breasts, there is absolutely nearly a guarantee that you are going to have, and I always say this, I hope you live long enough to need another surgery on your breasts. Like when women say this to me when they're 60, like, oh, never doing this again. I'm like, I hope you do, because that means you're still alive and healthy. So just know in your mind, the younger you start, so when you get your implants put in, the younger you are, the more surgeries you'll likely have. Likely, not necessarily. We have patients who've had their implants for 40 years without issue. They don't get another surgery until they're in their 60s. So it is not a one and done surgery.
The FDA has such a bee in its bonnet about this. We have to have our patients sign 10 pages of consents that are not even related to the consents that we have.
That are specific about the implant. And this is
about
one
the
of
implant.
them.
And one of the big topics in that paperwork, and all the 3 main implant manufacturers require us to have our patients be consented with this, which is Allergan, Mentor, and Sientra. That's in the United States. We got a comment and someone was talking about one of the alternative implants and said it's going through FDA approval. And I was like,
no, they asked why we didn't use it. And we said it's because it's
no, but then they responded about it's going through FDA approval, whatever the case is. Those are the 3 main manufacturers right now. Okay. It's because of this, because the FDA was pissed off for good reason that people were not being told that this is not a permanent surgery.
This is not a lifetime device.
All right. And so they're like, okay, you're not going to listen to us. We're going to force you, the company, and by association, the surgeons, to tell the patients and have them read through this and sign it. So
breast implants are not a lifetime device.
It's not a lifetime device.
Yep. So
sorry.
You will need surgery again.
Busted.
Yes. All right. Number 4.
I need to lower my voice when I say busted.
Busted.
Yeah.
Busted.
Busted.
All right, we got sound effects.
Okay.
Yeah.
That's good.
No. Talk about number 4.
Breast augmentation is very painful. This is a myth.
Yeah. Well, I would say pain is very subjective.
Yeah. No, I don't think it's as painful as people think it is.
People
I
even had a woman, she's had breast implants for many years. And she said to me it's just, is it going to be just terrible? Like there's a car on my chest again. I'm like, no. And that's honestly not, and again, pain is subjective. I'm never going to tell you don't have pain. However, I think the myths out there, the perceptions that people have about breast augmentation is that it's this extremely painful procedure. And yes, it is painful, but it is not unsurmountably painful.
No.
Liposuction is more painful.
No.
And we do that in the office.
Postoperative pain is subjective, right? Mm-hmm. So it depends on the person, but it also depends on the surgeon. You have to have good technique, not be overly traumatic. You have to have a surgical plan, a quick surgery, an efficient surgery, good anesthesia. You have to use local anesthesia. You can use regional anesthesia. Keep going on from there. You give them muscle relaxants right after surgery so they don't have as much pain right afterwards. There's so many different things you can do. Where the implant is placed, above or below the muscle, will factor in. But no matter what, it definitely hurts at first. Okay, so those first couple days are tough, but after that, at least in our office, patients do very well. So it's by far not the most painful surgery we do. You could argue that liposuction in general is more painful than breast augmentation. If
more painful for longer.
Yeah, if liposuction is done aggressively, which we do, because you got, if you're going to do liposuction, you got to take the fat out and sculpt it as much as you can. So I think breast augmentation on a scale of 1 to 10, if 10 is the worst pain from a cosmetic procedure, 1 is no pain, breast augmentation is a 6 for most patients. And that's only in the first, couple days. And then after that, they do very well. The hard thing about breast augmentation that's not a myth is the not being able to use your upper extremities, working out, all that kind of stuff. At least in Colorado where we are, patients struggle with that. They get a little mental. They're like, damn it, I want to use my arms. I wanted to go do CrossFit. I want to do rowing. I want to do whatever I'm doing.
But that's any surgery. You're going to have downtime. And people not wanting to have downtime doesn't mean it's more painful.
But it's the upper extremity stuff. It's the arms. It's the alligator arms, keeping your arms in. That could be frustrating to people, but it's doable.
It absolutely is. And I will tell you this, the thing that surprises people, even though I warn them about this, I even have a video I send people after breast augmentation surgery, is people say oh, I'm in so much pain. They'll come in, I'm like, well, what hurts? My back.
Yeah.
Not once has everyone ever said to me, my breasts.
Yeah, I know.
Because what you do after surgery is this. You lift your shoulders up and you hunch them forward, and you can't help it. And
which is why we have these new arms now, right? Because I don't have to do this anymore I can rotate it around. I can sit up. Like, that's the problem. You're just kind of sitting there. You feel like you're having pain, and the thoracic, the upper back is what really hurts people.
Yep. Yeah, and that's
the lower back is what hurts after tummy tucks.
Yeah, so the antagonistic muscles, in massage therapy, we have the saying that says where it is, it isn't. Where you're having pain, that's obviously like the pain in your back. We didn't do anything to your back, but you might experience far more pain in your shoulders and your neck and your upper back than you are in your breasts, and that's surprising to people. So, breast augmentation itself is not a very painful or unsurmountably painful procedure. It just isn't. I think personally, a lot of this myth got started because maybe young people talk about this more, but people who've not had pain in their life and have a breast augmentation, and you're 22 years old and your breast's done and you've never had really pain in your life. Yeah, it's like the worst pain you've ever had. 40-year-old woman who's had 3 kids by natural childbirth thinks that this is the easiest surgery she's ever had in her life.
Are you implying that she's rode hard, Amy? Like she's going to war?
I'm just saying like life experience, like pain is subjective is what I'm saying.
No, I agree.
And your previous life experience. So where did this myth come from? I think it probably came more from that. Those are also the people who are more willing to talk about their experiences on social media and those kinds of things.
But social media just ruins it for everyone because like these doctors go in there, it's painless breast augmentation. And it's not.
No.
And so people go in there with a feeling of one way and they come out the other. Obviously, they're going to tell all their friends this is the worst thing ever.
Yeah.
So at least in our office, that myth is busted.
Yeah, busted. All right. Number 5. This is a good one.
Oh, yeah. This is my favorite.
Saline implants don't contain silicone. You have times people come in and say, I want saline implants because I don't want silicone.
Yeah. Right.
And what does Dr. Martin say?
The shell of the implant for the saline implant has silicone.
Yes, it's made of silicone. So if in your mind you think like, I cannot have silicone in my body, silicone is very inert.
Yes. It's a very large molecule, apparently, silica. And these molecules do not travel in other parts of your body, even with rupturing of silicone gel. There's been a lot of historical studies on this because actually silicone implants got taken off the market in the early 2000s.
They were much different. The silicone implants of the 90s were far different.
Right, but they got taken off the market for
good reason.
For big tort cases that really didn't pan out, and the science didn't show it.
But they were freaked out. Like that's what I mean. There was good reason.
It's
they were
okay.
scared.
I'm totally fine with it because it wasn't during my era. It didn't affect me.
In 2007, when they were back on,
actually, it was. I was in training then. Yep. Yeah. So the idea that you're not getting silicone exposure with a saline implant is not correct. The silicone shells, the saline implants have silicone shells. That's the balloon lining of the implant itself. And no matter what people tell you or the companies, you're going to have shedding of silicone.
Or absorption, essentially.
Exposure to that. It's going to get into the soft tissue around it. It's inevitable. Your body then will naturally form a scar tissue around the implant, and then that will stay contained in that area. Which is fine for most people, but in some cases, people get chronic inflammation, usually due to contamination. And then they can have the rare problems of anaplastic large cell lymphoma.
Focus on the myth,
I know. And capsular contracture. But in most cases, that's going to get walled up.
That has nothing to do with our myth.
I know. So if you're concerned about silicone, saline or silicone implants, or you're having probably a similar amount of exposure unless you get a rupture of the implant itself.
Yep. And there are things that you are exposed to potentially with saline implants that you are not exposed to potentially with silicone. And I think the number one thing there is mold. There absolutely have been documented cases of mold growth inside the saline in a saline implant, not completely inert. So there, everything has a trade-off. Like everything.
The reason that people use saline, it's cheaper. Secondly,
cheaper.
You can make a shorter scar because you can put it in, underinflate it, and then inflate it up, which is meaningless.
It's meaningless.
It's difference between 3 centimeters and 5 centimeters is a joke along your inframammary fold. So I don't even get that argument. But I think the cost argument is probably the only one. And also, the good thing about saline implants, you can adjust them, right? So you can tailor the volume to a cc. So silicone implants come in 25 cc increments, right? But saline implants, you could make it 321, 322, 323. You can keep going.
If you've watched our episode about implant sizing, you realize that that's completely meaningless.
Right, but it makes the surgeon feel good. And then if you have an asymmetry, you can adjust it one way or the other. So in that sense, I could see maybe a surgeon, qualified surgeon, saying, I'm going to use saline here because you have such an asymmetry. But I would just say then I would just use 2 different types of silicone implants. Silicone itself is way more superior, silicone implants-based implants than saline implants.
Exactly. Yeah.
So do you think that myth is busted?
It is busted. There is silicone shell on your saline implant. Yes.
You didn't let me finish my capsular contracture talk. It was like Will Ferrell. I always say this one. And what was the movie we always talk about?
Anchorman?
No, the one where he goes back to college.
Oh, Old School.
Yeah, Old School. And he's doing that test and he like starts saying all this smart stuff. And at the end of it, he goes, what just happened? That's exactly when I start talking about capsular contracture because it's so ingrained in my head.
But see, when we got myths, we got to stick to the myth.
I blacked out, Amy.
Stick to the myth.
Like Will Ferrell in Old School.
Stick to the myth.
Yeah.
We're going to take a quick break because we're halfway through. And hear a word from our sponsor. Let's get checked.
Let's get checked.
Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and it's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically, you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30,
yep,
so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
Yeah. We're back. Ready to bust some more myths, Dr. Martin?
I'm ready to bust them.
Sorry I had to get on you about jumping all over my coming myths.
It's okay.
Coming myths. Here we go. All right. Remember.
I can fall into these ruts of just saying what I normally say, and then I wake up 20 minutes later and I'm done with my conversation.
Keep it tight. Keep it tight. All right. Myth number 6.
You should get the same size implants as your friend, sister, your cousin, your friend's cousin's sister,
your boyfriend's
or this one woman that you saw at the gym. You're not sure what her name is, but her breasts look good.
So
which drives me effing crazy. Please, for the sake of God, we don't mind comparisons. We don't mind you showing us examples of things you like, and that's your aesthetic vision. But saying that your so-and-so friend who you barely know got 330 cc implants from Mentor, moderate plus projection, and that's the ones you want. I just want to poke my eyes out to even saying that. So
we have so many great episodes where we talk about implant sizing. And Nils, if it's not too much trouble, and I didn't ask you this ahead of time, would you mind inserting the clip right here where I talk about implant sizes? It's about to show up right now. Here it is.
Here it is.
So this is what I do with patients.
You have to watch the YouTube channel. I'm sitting here very uncomfortable. She moved everything.
So this is a 310.
I'm going to put it right up here.
This is a 310. Okay, so these two implants are the exact same CC size. Try not to make Nils' expensive computer fall off. If it was the Chromebook, I wouldn't care. So these implants are exactly the same size. They are both 310 cc's, but as you can see, they are totally different implants.
So this one has a very wide base, the one that's not as projecting, and the one that is more projecting has a very narrow base. What is the difference on these bases? Probably a couple centimeters.
Oh, for sure.
Yeah.
And then let's really confuse matters by putting this 350, right? So these are actually 310s, I should say. They were, to be precise, these are 310
That weirds
cc's.
me out because the 310 looks bigger than the 350,
Correct.
the one with the narrow base.
Right? But really, I mean, if you look at these two implants, these two implants, a 310 and a 350 have the exact same projection, but very different bases. If you hold them this way, you can kind of see that, like this one's taller. So these project the same. This one is the same amount of cc's as this one, but it has no projection at all.
You're blowing my mind, man. Stop it.
So let's just assume, Nelly
That's
girl.
like an MC Escher kind of looking at it.
It is. It's like the fork. Is that how many times are on the fork? Let's assume that you have this is a moderate projection implant. This is a 310. So this is probably similar to what you have. This implant is a 425. Okay, has basically the exact same diameter at the base, but look how much more it projects.
Yeah.
So it projects almost the same as this little guy, the 310, right? Same amount of projection. So if you have the 310, going up to a 425 isn't going to change the projection of your implant at all. All it's going to do is add width. Whereas if you have the 310 that's this one, it's not going to change the width at all.
It's going to change the projection.
It's only going to change the projection.
Yeah, so interesting.
So this is why you see that 420, going up, I think you need to go up to at least a 450, which you can do keeping the exact same diameter, just increasing the projection.
And the diameter matters because the pocket's already been established by the surgeon. And so you think about it, you probably don't want to go wider. Probably that implant fits you. So your only choice is to have a more projecting implant, which will look a little more augmented if you're of normal weight or lower weight.
But yeah, but it also might not, and it kind of seems like you would like a little bit more to balance out your hips. So you probably need the projection. Now, if you have, if like Dr. Burns said, if you have this implant that's very narrow, to go up to an implant that's very, very wide, you'd have to re-dissect the pocket a little. But just to go from these two, right? Going from
by the way, it's very hard to go from a wider implant to a narrower implant. And that's where you get into grafts and doing pocket work, which is definitely more expensive and more involved. Yeah, I've never seen you do that. That's actually really interesting.
This is what I do with every patient who comes in for breast augmentation with us. So the myth, we do say that on our episode about implant selection, is that everybody wishes they'd gone bigger. That's not true. It's not if you're sized correctly in the beginning. And that's why expectation is key. If someone is saying to me, and there have absolutely been times where I've pushed a patient to an implant that they're like, this is way too big. A month and a half after surgery, and I say, how do you feel about your implant size? It's perfect. I'm so glad you pushed me to that because that comes with understanding the base, right? These two implants, if someone's like, oh, I don't want to be anything bigger than 300, but you see that this is going to basically look the same on two different people.
Yeah.
A 425 and a 310 is going to look exactly the same on a very petite person and a moderately sized person, even though they're different sized implants.
Yeah.
You get the same amount of projection.
Yeah.
It's just which fits.
Yeah. And I think that that's really important. Also, when we say we push people bigger, it's only 10% bigger. So it's the reverse of what
we said before, when we give people ranges, it's usually with pretty close to each other. So we're not saying, hey, you could do a 275 or a 450.
No, but there are patients who come in like, well, my friend has 300s and they look great on her. I'm like, right. And your friend this is your friend. Your friend is 310, right? To look like your friend, you have to do 425.
Every time I see implants samples, I think about a time that a patient came in and I handed it to her so she could feel it, and she handed it to her 2-year-old, and he started like playing with it like it was a doll.
Yeah,
and I was like, this is so inappropriate.
Well, this is honestly like a lot of the time, this is what my desk looks like.
Yeah.
It has implants all
we
over
have a weird job.
Yeah, I got a very weird job. Like my job is weird.
Yeah.
So, and this is one more point, and then I'll be done with the implants. So 350. 425. This is the 75 cc difference that you think would make a difference. You see how it makes none.
Hopefully they can see that at
like,
home. Yeah.
Literally no difference. These implants project about like a 1/10 of a centimeter different.
Yeah.
The only difference between the two is a little bit of width.
That's crazy.
So to just size up in the same profile of implant, 75 cc's, you would literally on most people, unless you were extremely petite, you would never notice the difference in 75 cc's. You just wouldn't.
Yeah.
So you can see there, that was actually a question from a listener where she was asking about implant sizing essentially, and it was just the only way to describe it was to show it. So the big myth with implant sizing is that there is a size that is going to give you a specific size. There isn't, because your body is different than everybody else's. So the same size implant, and I
feel like Mr. Rogers right now. You are special. You are an individual.
Special. I go back to this. We did surgery on twins. Identical twins.
This ain't no joke.
Different size implants.
Beautiful, young, perfect young women. They were identical twins, identical.
Yep. And they had different size implants. Now, granted, they had slightly different vision. They didn't want the exact same thing. So even two people, even if they had one of the exact same thing, another day we did breast augmentation surgery on 4 patients in a row. 3 of them got the exact same size implant. Look totally different. Totally different. One of them started out as a very petite, barely A. Another one was already a D. So volume is volume. It doesn't change the breast you have. It adds volume to the breast you have.
Right.
So based on your breast size, your shape, you saw that in the video, the diameter, your implant is going to be perfect for you, but it has nothing to do with the size of anyone else in their implant.
Right. And we start out with the width of the chest, right, Amy? That's the main measurement. And then we decide the projection from there. And with these newer implants, you have a little bit of projection, moderate plus, a lot of projection, and a lot of projection. And that doesn't even get into the form factor of these things and the build of these implants. So you start with your width, and that's where if you're looking for a natural breast augmentation, and then you go from there. And that's the key. And that could be different on like 2 people that look similar. If you look at their chest measurements could be totally different.
Yep.
So we do appreciate the fact, and you as a patient need to look on the internet, see what you like, see if you like natural augmentation, more augmented appearance, whatever you like, so you can speak.
I wouldn't search though for breast augmentation pictures. Just find pictures of breasts that you like.
It's weird. Like when people do that, they always come in with pornographic pictures.
And I say,
it's like you're looking at
the
person and talking to them. There's no relevance to them. They're not, that's not them. And I was like, I wish.
Do you want a 700cc implant?
No.
No.
They think they want it. And then you explain to them what that would look like. Like, oh, I don't want to look that. Because most of the time, a huge implant just makes people look fat, especially
petite people.
Yeah, if they're not tall. So, yeah.
Yeah. So your implant is your implant, and like own that. Get your perfect implant.
And you can tell your sister that myth was busted. Because the sisters always say like, oh, I think you should definitely get my 600. That's what I got.
Well, or 350.
Does he know what he's doing?
Right. Like this doctor said this was the only implant for me. I mean, like whatever. Tell them to watch the video. Myth number 7. If you lift weights, you should only have implants above the muscle.
Yeah, I don't agree with that.
Right. And I think though this was a very common myth for a long time. And we even had patients who, they came to us, they had implants above the muscle, and we say like, what was the reasoning behind that? Like, oh, well, like I do this. And like they said, I had to, or people think that the implant's below the muscle, that somehow you are so strong that you are going to force that implant out of the pocket with your massive she chest. Like that's just not going to happen. But
is she chest a term?
Well, it's not he chest. It's she chest.
Okay.
It is now.
I'm totally using that again.
I am definitely getting shirts printed this year that say squat ladies.
Yeah, squat ladies and she chest on the back.
Bench.
She chest on the front and squat ladies on the back.
Squat ladies on the back.
Yeah.
So, but there, there is, okay, so yeah, you could think like, okay, sure, that makes sense. What are the downsides of having an implant above the muscle? Implants show. It's going to have more pressure on the soft tissue parts. What are those ligaments, Dr. Martin?
Yeah, the Cooper's ligaments. The ones that you finally learned after 15 years of working together.
I just had to associate it with something, and then I finally got it.
You are the smartest, sometimes not smart person I know. Like literally, you're so smart. You are so smart, but that you have brain blocks.
Oh yeah, my deficiencies are big.
So yeah, Cooper's ligaments. Even though you kind of got it wrong during that last episode, which was the breast implant 2.0, but then you corrected it. I can't remember.
Oh, we were talking about textured implants and capsule
formation.
Yep.
Capsule formation is higher. Yeah,
yep.
Is higher above the muscle, not below, and that's because we talked about the implants go near the ducts. The ducts have bacteria in them.
That's the biofilm.
So the biofilm theory of capsular contracture, you should look that up. Very interesting stuff. And that's the theory why you have worse capsular contracture above the muscle. Below the muscle, is more standard, it works better, but then you can have this problem called window shading deformity. You should look that up too. So if you lift weights, if you're a super competitor, your whole life is about weightlifting, the Olympia, body posing and stuff, maybe it's better to do it above the muscle. But a standard person that lives a fairly standard life but really likes to do resistance training, it's not going to really affect your performance because you're not at an Olympic level. Right. You're not.
Your sheet chest is never going to be that strong.
The amount of power that you lose with putting an implant underneath the muscle is minimal. It's barely even measurable probably. So it's going to be some loss of power when you have a muscle. It has a longer distance to go when it has to go around the implant to contract than straight from the attachments of the pectoralis major muscle, which are what, Amy?
Sternum and the...
In the
out of the humerus and the acromion process.
Yeah, there we go. You go, girl.
I taught the anatomy.
Yeah, we know this.
Yes.
And Darwin, the massage teacher, said you never use the crack to hold your keys.
The crack is not a handle.
Yes.
The crack is not a handle.
Yep.
That's for working the gemellis.
We've heard all your stories. Yeah. Nils and I have.
Yes. But Dr. Martin, I think there's an interesting thing here, though, is that I would say that one of the more common placements of breast implants, especially now, is doing like a dual plane.
Yeah, and that's underneath the muscle, and the lower portion is you release the muscle enough so the lower portion of the implant is basically not covered by the muscle itself. So
so kind of meet in the middle. The other thing you can do
there's variations of that. I think most people do some semblance of a dual plane. I can't speak for everyone. It's interesting. I was talking to the rep the other day. She was telling me that a lot of people are going above the muscle now, and I think it's probably because it's easier. There's a lot more competition. And also some people, I think the idea of implant show is a little more tolerated now maybe than it was in the old days. I'm not sure. It's cultural changes, preferences. If you're not doing a huge implant, an implant above the muscle, if you have breast tissue, probably works well. And in some ways, it could give you a little bit of a lift. So it's not that above the muscle is bad. Yeah. It's just kind of surgeon and patient preference. But
we've gone above the muscle.
Yeah.
And when we do, it has been in competitors that are, I would say, figure and above. So if you are bikini, maybe some wellness, figure maybe like non-pro figure, you can get away with an implant definitely below the muscle. Now, if you are going to bodybuilding level, they actually have to do poses that contract the chest, whereas those other classes don't. In that case, if you had window shading of your implant, it would look very odd when you're basically wearing no clothes.
It would look terrible.
So we have for our bodybuilding patients, actual bodybuilder category, so figure and above, but pro figure and above, yes, that is a case where it would have an impact if you lift weights aggressively like that you may want your implant above the muscle. Totally. And you're showing it. In that case, that is not a myth. But for your bikini competitors, non-pro level figure, wellness, like you're not doing poses that force you to contract your pecs or your chest muscles. So there's no reason for you to think that you can't have your implant dual plane or below the muscle.
Put it where you want on your sheet chest.
Yeah,
it's all
on
good.
Your sheet chest.
So Amy, what do you think about that myth? What was it?
It is busted.
But
maybe also somewhat true.
But kind of true.
Yep, that one's a halvesy.
The pain one was a little bit true too.
That was a halvesy also.
All right.
Yes. All right, myth number 8. Here you go. Get all in on this, Dr. Martin. I don't even know.
I'm not doing this one because I don't even. Who says this?
Oh, a lot of people think that mammograms are. People in general. The general thought is that all you need to do is your mammograms. Mammograms are sufficient for implant screening. That's what people think. Like if you do your mammograms, you do your breast exam, like you're good. That's absolutely not true.
Not true.
And this is one of the things that people who are doing elective surgery should know, because the test that is recommended, and actually the only test recommended for breast screening,
MRI, all up in your eye.
Yep. And breast MRI is specific. It's a specific type of, they call it coil that is specific for the breast.
It's magnets.
It is not going to be covered by your insurance.
You can't take metal in there.
Yeah, you cannot take metal in there.
Made that mistake as a resident, and
would you have your badge?
No, it was my. It was pager. I was like trying to remember what was the old days. What do we have
on the hinge?
What was that metal thing I had on my?
Well, it wasn't. It was the clamp. It was the clip part.
The clip part.
Yeah.
And I started to feel my pants move,
like vibrating,
not in a good way.
Yeah.
And I was like, and I wasn't even in the room, thank God, because that could have been destructive.
Fling it into the
because it would have gone into the magnet and maybe hurt it. So, these things are super expensive. And I reached down. I was like, oh, shit. So I closed the door and took that off.
I had that happen with a name tag once. When I was working for Health South, we had these magnetic name tags, so that you didn't put holes in your clothes. And I'd walked into the room and all of a sudden my shirt's going like this. I'm like, you guys.
Yeah.
Yeah, so breast MRI is the gold standard and really the only implant manufacturer approved to screening of your implants. They recommend doing your first one within 2 years of your implants, and then depending on the implant manufacturer, every 4 to 5 years after. You can also do breast ultrasound. Breast ultrasound, they're just going to then send you for a breast MRI. So if you suspect that you have fluid around an implant or you have an implant rupture, the only way to really see it is with a breast MRI.
If you talk about the algorithm for researching like anaplastic large cell lymphoma or certain things, the ultrasound is first. Some insurance companies may require you to do an ultrasound before you get an MRI, but they may or may not pay for this related to breast implants. We have no idea.
They will likely not. I would say.
But I'm just saying. Yeah. So we're not guaranteeing the insurance would pay for any of this.
I will say they won't.
So, and ultrasounds can be pretty good, especially if you have a good ultrasonographer, but that's not guaranteed. And a lot of times it'll be like, can't rule out. They'll say things like can't rule out rupture. And that's what they say with these mammograms too. They have these 3D mammograms now, these higher end ones, which by the way, do give you radiation.
Lots of radiation.
Yeah,
there's a huge dose of radiation.
There's a little bit of this. I was like, well, I'd rather get an MRI. The reason they don't do MRIs for breast cancer screening is it's highly sensitive. It has a lot of false positives. It would wreck the healthcare system. It's cost too much.
So we'd rather just dose you with so much radiation that we're going to cause breast cancer.
This is Amy's take on medicine. This is not mine. So
radiation.
This is every single time.
Yeah.
So I wish I didn't bring this up. I knew it. It's like if you're married, like with your significant other, you say something and you wish you just take it and put it back in your mouth. That's kind of the feeling sometimes I have with Amy about these hot button issues.
Well, but be educated about what you're doing to your body.
We got you.
Yes.
We got you. But right now, Amy, in our world, we do mammograms, and that saves lives. So we're not dissuading people from getting mammograms.
No, absolutely not.
Okay. But it's not ideal for implants, even with the newer types of mammograms. So an MRI is the gold standard, and that's almost 100% sensitive, not 100%, but it's really, really close. So if you have a rupture, the MRI will tell you, but the MRI costs money, and it's in most cases going to be probably a couple $1,000, and that's a lot of money, especially since breast augmentation for most people that get it is considered a commodity. It's the lowest common number, and that's what people shoot for, which is frustrating about breast augmentation because
it's not permanent. So you're going to think in your mind you got to pay for it again.
It should be about quality, but that's just not the way we are with breast augmentation. A lot of the other surgeries I do are about quality, but breast augmentation is about money in a lot of cases. And you think about it, so this is say in a really competitive place, people are paying $5,000 for all in on a breast augmentation. That's pretty low, or $4,500, something really competitive. You may end up paying half of that just for an MRI in a couple of years if you're worried about rupture.
And triple that for someone to fix your breast implants because they were not done properly the first time.
Yep.
So yeah, just know. And my big point with this myth is it is busted. You definitely breast MRI, but keep in mind, when you have elective surgery, there may be elective consequences, meaning that you are paying out of pocket for future things.
So what was that episode? There was a good episode on that.
The cost of surgery?
Yeah, cost of surgery.
Cost of surgery.
That was really good.
Yeah, cost of surgery is good.
All the ones that I like are the ones you come up with that I never would have come up with. I never would have come up with that.
It's because I'm the one who has to answer these questions and bust these myths. All right, we're almost there. Myth number 9, breast implants cause breast cancer. That is 100% a myth. But breast implants do cause a specific type of cancer that is actually a lymphoma.
So, by the way, I was laughing too, because we have a very loyal following and our view rates are high and our hourly watch numbers are really high, but we're not huge per se.
We're not huge.
So we're not big enough to get crowdsourced, because basically if we were, people would be like, Martin didn't say this right, Martin didn't say that right, So I've had a luxury up to this point. If we get too much bigger, that's probably going to change.
Right, we can say the body's 97% water.
Yeah. And they're going to be like, no, it's 96%. Yeah, exactly. Yeah, which is one thing I like about the internet, because I welcome those kind of things. I actually personally like that, but you can never be 100% correct. Even in science, you could say something and somebody.
Well, the whole point of science is that it's a evolving thing.
People can find studies that show something different. But so I'm going to say something now, and I didn't read the study today. So there was a large study, and it was called the nursing study. And that's where they came up with a lot of data on
the Nurses Health Initiative.
Yeah, Nurses Health Initiative, where they came up with all this kind of numbers on autoimmune disease with breast augmentation. It was actually looking at breast cancer, and per memory, women with breast implants did not have a higher incidence of breast cancer in the study. And this was a huge study, over 100,000 people.
It was actually over 250,000. Like, it was very big.
Yeah, so it was very large, and they followed these nurses for a long time. So I can categorically say, at least from the stuff that I've read, that breast cancer incidence does not go up with breast implants. And if it did, the FDA wouldn't allow them to.
And it would be seen. I mean, especially because the rates of breast cancer have increased so much and our detection has changed so much. If there was a direct correlation, it would be known.
Yeah, and it may be hard to make correlations like this on a population level, but at least
this one would be pretty easy.
This one I think would be easier, just because of the amount of data we have. Yeah. Breast cancer is one of the most studied cancers in the human's face, and there's
and it has exploded. I mean, the rates of breast cancer
rates are getting higher. It's probably in large part because people are living longer, or teratogens or environmental exposures are going up,
and detection is better.
Yeah,
I mean, there again, get your mammograms.
Mm-hmm. So yeah. That's one thing I thought about. Like, some of these breast cancers, maybe it would have been indolent. Nobody ever would have caught them because people weren't looking for them.
Correct. And is that the reason? Anyways. Is that the reason they died? That's the hard part. And I'm not going to talk anymore about radiation, but I'm just going to say that is the hard part. Increased detection means increased treatment, means increased money for these companies, means increased money for the hospital. I sat in the wrong
seat on a plane, and I'm just sitting next to the person that won't shut the hell up. Tell me more about yourself, random person. Hey, by the way, when I pull this book out, I'm not listening to you, but just keep talking.
Please tell me what you think. All pharmaceutical companies are just out to cause breast cancer. It's not what I think.
All right.
But it is important to know, and this is very important to know when you're getting breast implants, that there is a specific type of cancer that you could get only because you have breast implants, but it is not breast cancer. And it is very treatable and extremely rare. And that is breast implant associated large cell anaplastic lymphoma.
Yeah. Anaplastic large cell lymphoma. Yeah.
I said that backwards.
Yeah, that's fine. That's okay.
The dyslexia is real. So yes, is it true that you could get a type of cancer because you had breast implants? Absolutely. What's the treatment for it? Remove your implants.
Yeah, in the capsule.
Yep.
There's been a few patients that when Amy and I were looking through the data that had metastasis, but that was extremely rare, a few deaths, and it's hard to know if those deaths were truly related to ALCL. That's a T-cell mediated lymphoma. There's also cutaneous T-cell lymphoma that's treatable and survivable. So this is not something that most likely would kill you, but it's very rare and it's problematic. I mean, it's concerning.
It is. Yep. So I highly recommend going back and listening to our episode about breast implant controversies. I can't. It's the splasm all over again. The blessed.
Splasm.
It's the blessed. The breast implant controversies episode, we talk in detail about not only breast implant illness, which is a group of symptoms that are autoimmune related, but also BIA-ALCL, which is the large cell lymphoma that can come from breast implants.
And the capsular contracture.
Yeah. So breast implants will not cause breast cancer, but it does have a risk of a different type of cancer that is only related to breast implants, which is in the name, breast implant associated. So this myth is busted.
Busted.
Yes. Number 10.
I can barely even say busted anymore. I'm so cocky about how much we're busting here.
Number 10 is maybe the biggest myth of all time. Like this, I almost did them reverse, but I'm like, well, no, we'll just do. So number 10 is the biggest myth of all time. Dr. Brown, what is it?
Oh, I wish it would have gone bigger.
No. Everyone thinks. This is what they say to us. Everyone says they wish they'd gone bigger.
Wait. So everyone, are you saying that people come in and say everyone wishes they had gone bigger?
That's what they're afraid of because they think that everybody thinks that.
Oh, okay.
That is the myth.
I got you.
That they think that everyone wishes they'd gone bigger.
So the patients that come in and
have no implants. Yep.
They're like, everyone wishes they would have gone bigger.
Correct. That's the myth.
Who is perpetuating?
Who's everyone?
Yeah, who's...
This is the crazy thing. So I was really thinking about after I did this episode, how many times we've upsized a patient, our patient, like we did their initial. I can think of 2.
I can think of 1 off the top of my head.
So there's one. A woman got breast implants. She was in her early 30s. Her husband was very concerned about her getting these breast implants, wanted her to go very conservative. She got a very conservative implant. Fast forward 5 years, they got divorced. She came back and wanted to blow it out.
Yeah, she's like, he's gone and I'm ready.
Yep. So great.
I totally remember her. That was exactly one. Because I remember thinking to myself, like, Okay. I mean, I really did have a serious conversation with her. I said, like,
are you sure?
Like, we really need to work through this. Like, I really want to be pragmatic. I don't want to make an emotional decision. And she started chuckling. She goes, this is not an emotional decision. This is what I wanted from the start. Yep. And she goes, I'm going to have that now. And I was like, okay.
Yeah.
I'm with you.
And very low risk aversion with this patient, meaning she has lots of money and has no fear about, she knows she needs a lift in the future. She was not quite 40. So like she, in her mind, absolutely knew that she probably wasn't keeping this big forever. Just wanted to do it, Like she'd had implants, she liked them. She wanted to go big.
Yep.
And we did. And she's super petite, super happy. So that's one. The other one is a woman who came in, was wearing one of the bombshell bras from Victoria's Secret that adds 2 cup sizes. She's like, this is what I would like to look like without a bra on. That's what we did. She came back in. She's like, you know what? This is great. And now I realized that I'd like to go bigger. And she did. And the best part about this is, so we upsized her a lot, which was fine. I mean, she could carry it off. She was a big bone person. Like she could absolutely carry off a 500 plus cc implant and have it still look totally normal. She got a capsule on one side and she loved it. Because it made the implant not only bigger, but also higher.
Oh, yeah.
So she wanted the other one higher too.
Yeah.
We're like, well, actually, that's like not a great thing. But yeah. Like, so those are the two. Those are the only two. How many times have we downsized a patient?
More than upsized.
All the time.
Yeah.
All the time. And a lot of those are cases where a woman got implants when they were married or with a significant other.
A lot of those aren't our
and
patients.
then they want to downsize.
Yeah, they want to downsize.
Or they are our patients. We're doing one in a month or so. Or patients who just want their implants out entirely.
Yep.
And surprisingly enough, we have never taken implants out of somebody who wants them back.
I know.
Ever. So the myth that everybody wishes they'd gone bigger is absolutely not true. And I would say across the board, we have never upsized someone over the age of 50.
Right.
We've only downsized them.
Yeah, and I guess this is anecdotal.
Yeah, it is.
In our
it's
experience,
completely anecdotal.
But I'd take anecdotal evidence over some random myth, that everyone perpetuates. And in reality, most people that come in our office, again, we're in Colorado, tends to be fairly normal people with natural aesthetics, but they don't want to look garish. They don't want to look over augmented. That's not what they're going for.
Right. They just want to look balanced.
Right. There is a subset of our population, primarily live on the coast, but who want that. But in a majority of, if you just take all of America, I think that they would want something more in the middle. And the upsizing would be someone who really wanted something with tons of implant show, tons of projection, distorted breast appearance. And they went to a surgeon who was trying to be conservative and decided to do something he felt or she felt that was more appropriate for the measurements. And the patient was like, I don't like this. So,
well, and it's fine to want more. Like it is totally fine to, if you did get breast implants, if you go back in that episode that Nils showed earlier, that clip was actually from a patient who wanted to go up in size and explaining to someone how much bigger they need to go. And I think that is the one with people like, oh, like, we did the 350, we should have done the 375. I'm like, wouldn't have made a difference at all. Like you would have had to go to 425. Yeah. So I think that is maybe a myth that people think that like a tiny difference would have been the difference. It wouldn't. And the same thing going smaller, and that's the hard conversation to have with people when we're downsizing somebody. You have to downsize a lot more than you think to have it actually be a meaningful difference. And in some cases, that's challenging to do. But I think the great thing about all of this with breast implants is, you know what? They're not a lifetime device. So blow it out, go big. Or start conservative and go big later.
I'd rather you go conservative. It's harder to go down.
It is harder to go down, but you also probably need a lift at that point.
Yeah,
you probably
need
the lift anyway.
Yeah.
And I think the patients who had big implants, I mean, we do have patients who say they've hated them from the day they got them, right? But that's rare.
Yeah.
More common is the woman who's like, I loved them. They were the best ever. And now I'm ready to do this, or now I'm super into golf or whatever, you know? It's rare that someone, regrets their large implants, but the ones who do.
Over, Amy.
It is. And I do feel really bad for the women who say like from the moment they woke up from surgery, they're like, this is awful. It's too big.
We've had those.
We have. And we've had those with a patient who had a 200 cc implant. Who have a very small implant. And what for whatever reason, and again, no judgment. Like if you don't like your implants, get them changed.
Yeah, take them out.
Yes. Like this is not a lifetime device. This is not a lifetime surgery. Like you can change it.
FYI, this past week, we did fat transfer to the breast and implant removal. Mm-hmm. Took me an hour and 15 minutes.
Yeah.
The patient
implant
was totally
removal
awake.
Is very easy.
And we just put fat in instead of the implant. It doesn't equal the volume of the implant, but the implants that she got implanted were absolutely wrong.
So bizarre.
Under projecting, super wide.
Weirdest implant ever.
Dumbest choice ever.
That's not her choice.
It was the surgeon's choice.
Yeah.
And she was so much happier after surgery, like ecstatic.
Yeah.
She's like,
downsized a patient earlier in 2022 who was extremely petite and also a bikini competitor. And when she would get very lean, I mean, her implants were way too big for her body. So she actually, her breasts looked so much better, and they almost looked bigger, smaller, because they looked like they fit her body. So like the curves made more sense.
Yeah. She didn't like half her breast wasn't side boob. And
yeah,
it was one of the hardest cases I've done.
Body.
Yeah,
that was really hard.
I don't even want to think about that case.
But she was, I mean, this woman weighed like 80 pounds.
Yeah,
you know?
She looks amazing now. That was a hard case though.
But my point with all of this is not everyone wishes they'd gone bigger. In fact, most people wish they'd maybe gone smaller or decide to go smaller. Maybe that should be what it is. Most people, when they're changing out their implants, it's very rare that someone wants to go bigger.
Right.
It's very, very common that someone wants to go smaller.
Right. I think we busted that myth.
Yeah, we busted it.
This is too easy.
We busted all the myths. So I would love it, though, if you would leave us a comment with the myths that you've heard, because like I said, there are many more, and it was hard to narrow it down to 10. I mean, we didn't even get into things like capsular contracture and the causes and all these other things and these things that people think about implants and massage this way, do that, wear this, like, oh my gosh. There's so many things that people think like that, like, Yeah. You said in one episode that you do a lot of physical things like, Yeah. So please leave us a comment. Tell us what your myth is, and we can see if we can bust it or confirm it, because you saw that we had two that were like, maybe they're the busted-ish.
Yeah.
There is some truth in them.
We're definitely getting a comment from somebody who was like, yeah, that hurt like hell when I had a breast augmentation.
Yeah, sure it did. I mean, that's your pain.
Oh, yeah, we're with you.
Absolutely. There are also people who wish they'd gone bigger. Yeah. We're saying there's things that hurt more.
Yeah.
And lipo is one of them.
And lipo is one of them.
Yes.
It's funny because liposuction and breast augmentation are two of the most common surgeries we do. For some reason, breast augmentation got the pain rap, and everyone's like,
or facelift. People think the facelifts are going to be super painful.
Right.
And
then everyone with lipo, they're like, oh, it's like cool sculpting, right? You just kind of do it.
Cool sculpting is also not pain free.
It is. It's not, which is so weird.
Yeah.
Everyone thinks you can cool sculpt and freeze the fat. Like
and
basically causes your fat frostbite, okay? And then it's not going to hurt.
Yeah.
But if you've ever been really cold and then warmed your body up, it is so painful.
Yeah.
It is like the worst pain. I hate that feeling. So, yeah, I mean, I think myth busting episodes are probably one of my favorite episodes because we can run through things very quickly.
Well, it's more bust it. Like, don't be afraid. Like, if you've got myths or even just questions, like, please let us know. We would love to answer your questions and bust your myths.
Okay.
So if you would like to leave us a comment, a like, a rating, review, and subscribe. Subscribing is free. If you never watch another episode again, we'd still appreciate if you would subscribe.
Yeah, help us out.
You can find all the information here. You can also leave me a voicemail, which I love, at 303-630-9038. All of that information is also in the description box below with the timestamps. Tune in next time on February 1st. We're going to break down what our best year ever challenge is.
Yeah, I'm so nerve-wracking.
I'm so excited.
Like, are you do something big or small?
My thing is huge. Oh my gosh, it's so scary.
Is it going to be something that's extracurricular, like knitting or something like that?
I already crochet like crazy. It looks like a 90-year-old woman lives in my house. So no, that's not what it is.
All you need is the cats.
No cats.
And you'll never have a boyfriend again.
I mean, if I've ever had one up till this point. So, no cats. No cats.
Yeah.
No. So my thing is big and it's huge and scary. And I can't even believe I'm going to say it out loud. So.
Okay.
Yeah. So tune in on the February 1st and learn all about it.
And is Nils going to do one too or no?
Nils' life is. Yes, exactly. Yeah.
No, I'll think about it.
Yeah. Nils is just a listener at this point. He can choose to whether he wants to.
True.
Yeah. This challenge was to you, milestone birthday boy.
I know.
Yeah, I don't have a milestone birthday.
Yeah.
Well, the last thing I'll say about this before we go, I think people tend to. Been reading a lot about time lately.
Like the concept of time?
The concept
time travel?
of time, right? So time itself is not what we think it is. It changes where you are in the universe through the physical dynamics. We don't even fully understand.
Oh my gosh, who am
time.
I sitting next to on a plane now?
Yeah, I know. Number one, I can't talk to my wife about this because she's like, snooze fest. I don't even know what you're saying. Shut up. So
it's like quantum physics.
But the idea of time that we have is for us so we can function in this world, right?
But that's how you can make a person, like they use that as torture.
Right.
Like taking all the clocks out of a room and like torturing somebody.
Right. And it's only because of our modern lives that time has become such a feared thing, right? Because our lives are so inundated and busy that time becomes a problem, not a benefit, right? Like I'm sure I'm not sure, but I assume in the old days where you would sit around and time went a little slower and you could contemplate and like enjoy your life and enjoy the simpleness of it, right?
You mean 1990?
Yeah, exactly. Yeah. That kind of feeling. That's what I think of. So just FYI, birthdays, time, it's not all slipping by. We all have agency. We all have an ability in our lives to change it and make it more positive. And the blessing of being alive and existing is that we can do that, right?
It's really the only thing we've got.
Right.
Truly,
So
that everyone has.
one of my things, this is not my challenge thing, is to look at time a little bit differently.
Well, we all have the same 24 hours.
That's
right?
what I'm going to try to do in my 50th year of life.
Oh,
So.
you said it. I wasn't going to say it. I was
I'm
going to
cool
let the
with it.
people guess.
I still got this.
Seriously.
I'm coming after Nils.
You
man.
got those pulleys.
Pulleys and pushies.
Yeah. So, yeah.
You can cut that out, Nils. I'm sorry. This is
Oh, you can say it if you want.
Waxing poetic.
I like it. It's like this like the sands of time.
Yeah.
So are the days of our lives.
Yeah.
Yep. No, it's awesome. Time. It's all we've got. It literally is all we've got. So
Yeah.
if you don't think about it, it's Ferris Bueller. If you don't stop and slow down and think about it every once in a while, it'll pass you by.
Right.
And it will. Zoom. There it goes.
Was that the shower scene when he talks about the walrus?
I could be the walrus.
And he sings.
He got the faux hawk.
Okay.
Yeah, the shampoo hawk. All right, we're going to leave on that happy
Yes.
note. So thank you everyone for listening. If you made it to the end of the podcast, you're really a true fan, but this is some of the best stuff on the podcast is the end of the end of the end and the recap of the recap of the recap.
All right, just give us some more myths so we can bust them.
Thank you everyone.
Bye.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.